Good morning. Hope you slept really well. Good to be back, bringing you another blog. Today I'm going to be covering a topic called oil pulling therapy. It's a therapy that I've been doing now for the last week and a half or so. Been updating regularly on my Facebook page with the results of the procedure, and I've got to say it's pretty amazing. And the feedback I've had from people, the interest from people about how to actually do oil pulling therapy has been quite intense, so I thought I'd bring you a blog on it. I have to say, first of all, thank you to my dentist, Mark Mortyboys of Mortyboys Dental Spa. He's a holistic dentist, and he put me on to the book by Dr. Bruce Fife, which is this book here, Oil Pulling Therapy by Dr. Bruce Fife. It's not a particularly expensive book, so if you decide that pulling therapy or oil pulling therapy does actually interest you, then it's possibly something to consider doing first is buy that. Always clear things with your doctor if necessary. The one thing he says in the book is that actually, because you never swallow the oil at any point, then it's not actually going to cause you any problems. But as with any procedure that's supposed to boost or assist your health, it will boost your immune system, therefore you can suffer from healing responses, be it healing crisis and so on. So first of all, what the technique actually involves is taking a small amount of oil. It can actually be any oil, but I'm using a virgin coconut oil. Any oil, as I say, is usable, but why not use the best kind of oil you can, and coconut oil is a very good oil, also high quality olive oils and so on. But as we say, I'll go with the coconut oil because that's what I've been using. What you to do is to take a small amount, put it in your mouth, and then basically just swish it around like you would a mouthwash. Put it through your teeth, move it around your whole mouth, and make sure you hit towards the back of the mouth. And here's the kicker, but for 15 to 20 minutes. So you would do this normally in the morning. Morning and before lunch are the best two times, because that's when the bacteria content in your mouth is at its highest. And what it does is the oil actually pulls bacteria out from the teeth, between the teeth, much better than, or so it's believed, much better than mouthwashes and so on. Studies have shown about double as effective. So I don't actually do the oil pulling on its own. It is part of my normal oral hygiene. So what I usually do is put in about 2/3 of a teaspoon, because I started off with about a whole teaspoon. It's just too much because it mixes with your saliva. If you put too much in, once you start creating the saliva, you actually get so much volume of liquid in your mouth, normally after about 5 minutes, that you actually have to spit some out. So as I say, everyone's different. I get mine down to about, let's say, 2/3 of a teaspoon, so it's not much at all. When it's in this state, because coconut oil at room temperature, depending on how hot it is, can be liquid. When it's in this state, the first 5 seconds to 10 seconds are actually not unpleasant, but the texture's not great. So you want to make sure that you don't put too much in, and if the texture's not great at that point, you can actually heat it up just in under a small flame and make it liquid, and then start from liquid, which is much easier. But I'll show you the not so nice way. However, first thing I do when I get up, before I start, I actually want to hydrate around my mouth a little bit, because you can be a bit dehydrated, and just by putting a bit of fluid in, you'll get the salivary glands going as well. So little tip from Paul Check, which I heard in one of his talks. That first liquid you have in the morning should be water, but before you drink anything down, always swish out your mouth and get rid of a lot of bacteria, which is kind of what this is doing anyway. Now, because it takes 15 minutes, normally what I would do is start oil pulling and then go off and do something else. In the morning, a shower. Best thing you can do. Put the oil in, go in the shower. I'll discuss some of the benefits I've had since doing it all this week, but here we go. I'll see you in about 15 minutes. So there you go. 15 minutes. Teeth all nicely oil pulled. What I like to do is when I've spit it out, because you can get quite an oily feeling in the mouth, is just rinse with a little bit of water. Probably takes 2 or 3 attempts. And there you have it. Now, I don't know if you'll be able to see, but that's pretty dang clean, really. This tooth here, you suffer with quite a lot of browning, and since I've been oil pulling, it's fair to say it's really cleaned up. My gums have got a lot better, as it said it would in the book, and this only in a week. So I'm pretty impressed, really. My sinuses have started draining. So what I was saying before about having a healing crisis, that kind of happened to me a little bit a couple of days ago, where I actually abdominally cleared out a little bit, as well as in my sinuses. Now, that can be quite normal, because what you're doing is, by removing bacterial infection in your mouth, you're actually boosting your immune system. So you can expect to get healing crisis. Sometimes people get it after massage, sometimes people get it after rest. We often get it just before we go on holiday, or just when we first get out there, because we're resting and giving the immune system a chance to actually do its stuff in the body. But as I say, always look at, I suppose, following the proper approach. That's oil pulling therapy by Dr. Bruce Fife. Dr. Bruce Fife there. Always get clearance from your doctor if you need it, but as I say, you shouldn't really with this. Ideally, you want to oil pull for at least a month to see what effects it's going to give you. Got to say, for me, it's going to be part of my daily oral hygiene routine. So now I've done that, I'll probably have my breakfast and my tea, and then a nice bit of chicken thigh with mushroom and courgette, I think, this morning, and then I'll go through and clean my teeth as usual, and then in the evenings I'll do maybe 2 to 5 minutes of oil pulling, because it's not as effective in the evening, not as much bacteria, and then I'll follow that with my mouthwash, flossing and cleaning my teeth. So yeah, something to really consider. Got to say, from my first sort of 6-7 days of oil pulling, been pretty impressed, actually. Had a couple of people ask if I whitened my teeth, which is pretty great for a cheap natural approach. So yeah, if you do decide to have a go, then let me know what results you get. You can follow me on facebook.com/back2primal, and that's the number 2. Also on YouTube, you can type in the channel or go to www.youtube.com/itsyourhealthuk, but probably easier to type in back2primal. And you can go to my main site, back2primal.com, and check out all the different things I do. Qualified osteopath and health and lifestyle coach, corrective exercise coach. So hope that helps you. Hope you get some good benefits from that, and I hope it sheds some light on a pretty ancient approach to health. So take care, look after yourself, have a great day, be primal.